Okay. So hello, everyone. My name is Harriet Hunt, and my colleague here is the other way, Noreen Orr. We'll be telling you a little bit about ourselves in a minute. I'm going to start presenting the slides now. So if you bear with me, here we have our first slide, which is our sort of welcome slide, the workshop one, view from the bridge. Can everyone see that okay? Yeah,
yes.
Good.
Yeah, okay.
So the other thing is there's no pressure to put on cameras, to put on microphones, you know, just sit and absorb. That's absolutely fine. If you want to put things in the chat, that's also fine. One or the other of us will be keeping an eye on conversation. We've got some interactive bits down the line. So I will go on to our welcome slide. So in the chat, if you could briefly introduce yourself and just say what sort of things you think about when you think about creative communication. Just in terms of, you know, it could be a single word, it could be an emoji, you could put in anything that sort of makes sense to you. And we'll have a little look at that as they come in. So this is the first workshop of a 3-workshop series, which was funded by the researcher-led initiatives at the University of Exeter. I was very fortunate to win that funding. And the series of workshops is really to very simply show how research can be communicated creatively. Very simple aims. And we're not looking to teach comprehensively how to do this in lots of different ways, but what we are aiming to do is give you lots of examples, talk through our experiences of using creative approaches to communicate research for various audiences, various purposes. So hopefully that will be of use and will be of interest. These presentations, these workshops will be available to view after the event. So at the end of May, they will be hosted on the Engage Researcher website, and I will send a link out to all participants and anyone interested. So if you have friends who couldn't make this, get them to drop me a note and I'll make sure they're on the list. I'm also producing a workbook to sit alongside these workshops, which will have all the details from the slides and then a whole world of resources to signpost you to different examples, different specialists, different sources of advice, and then all the references from the workshops themselves. So without further ado, I will move on to our agenda. So you'll see here it's fairly well split up time-wise. We probably will have some wiggle between the timings of each section, but we're aiming to have a break just a bit after halfway through. We'll have a 10-minute break just to stretch, and we will finish by 12. So to begin with, we will have a very quick look at what's coming in the chat. Thank you so much, everyone. It's great to have, yes, lovely. Less boring than the typical, more digestible storytelling. Absolutely fantastic. These are all suggestions for what you think of when you think of creating communication. Communicating research creatively. So I love these really dynamic ideas. So that translational thing, using color, using infographics, using the visual side of things. This is fantastic. People with experience of soapbox science here, using lots of props, communicating to the general public to engage people, particularly that thing around engaging people who you wouldn't necessarily expect to enjoy or understand the work that you've done. We've got people here who are doing Point of Science this year, absolutely fantastic. So this is great. Thank you so much for all of those ideas and suggestions. That's really, really great. I'm just going to let in a couple of people from the waiting room. You're very welcome. We've just made a start, and I'm going to hand over now to my colleague Noreen to introduce herself and talk us through some examples. Noreen.
Thank you, Harriet. And thank you, Harriet, for inviting me to be part of this. It's lovely to reflect on some of this creative communication. So I'm going to just give you a little bit of background. And I am a qualitative researcher, and for a number of years, I've been working as a systematic reviewer, doing mostly qualitative evidence syntheses. I joined the University of Exeter in 2011, and that was to work on my first postdoctoral research project, which was a qualitative mixed method study. And that gave me the first opportunity to engage with the dissemination of academic research beyond the conference presentation and the final thesis report, which I guess when you're a PhD student, that's what you're focused on. And on reflection, I'm glad I did have those. I worked on projects that have involved dissemination beyond the traditional academic communities, because I've discovered that on the whole, I've really enjoyed reaching out to potential research and evidence users. So I'm going to share with you 3 examples of rather projects that I've worked on, just to give you a little insight into some of the creative methods that have been used. And before I sort of proceed on to that, just thought it was useful to share the NIHR's definition of dissemination, which rather straightforwardly says that it's about getting the findings of research to the people who can make use of them to maximize the benefit of the research without delay. So it is rather nice that without delay, because it can take a rather long time for academic research to actually filter down to the evidence users. So the creative communication tools help in getting key messages from researchers to the users. And hopefully if they're good, then it probably is without delay. Anyway, if we go to the next slide, Harriet, and this is just going to share with you, this is that very first project that I worked on, which was called Moving Stories. And it was an ESRC funded project which examined the role of physical activity on people's perceptions and experiences of aging. And the first stage of the project focused on the meanings, experiences of physical activity for older adults who exercised on a regular basis. And then the second strand was concerned with how other people at different stages of the life course, whether they were younger people or at midlife or indeed at an older age, how they responded to those accounts, those stories that people told about their physical activity. So in the first stage, I conducted life story interviews with participants and then went with them to their usual exercise session and photographed them being active. And then we also worked with a smaller number of participants and produced a short film, which was called Moving Stories. And we shared those, as you can see there, the photographs were shared at a photographic exhibition at the Eden Project Cafe in St. Austell. Was there for a month, and we had a lunch for that, and to which we invited participants and other people. And then we had a short film which was available on our website. And then we also created verbatim theatre, which we called Moving Stories, Moving On. Now, throughout this project, we worked with professionals, photographers, filmmaker, and artists and actors. Though we, the PI and I did also take some of the photographs, felt confident enough to do some of that. So you didn't need to be totally professional, you could still do it. So this is like this project, as you can see, that the kind of the creative research methods was kind of like built into the project. It was about using other ways of representing research participants. So we're using photographs and film, and that was all about evoking responses in others and sort of the aim to promote dialogue and discussion. So if we can go to second slide. Harriet. And this is the second example, which is really working with a partner called Sensory Trust, which some of you may know about, but it's a charity that's based in Cornwall. And its primary mission is to make outdoor places and the natural environment more accessible, attractive, and useful, because they believe it brings social and well-being benefits, and especially to those whose lives are affected by social exclusion. And Professor Ruth Garside from the European Centre, where Harriet is based, was the first. She developed a relationship with the Sensory Trust back in 2013 via an in-residence scheme, which was about identifying novel research opportunities that could be mutually beneficial. So well-being and the natural environment was a theme that was of mutual interest. And the Sensory Trust was also interested in how systematic reviews could explore the evidence base for their approaches that they used. And I guess they had long experience and kind of a tacit knowledge of what actually worked, but they were interested in what's there in the evidence base. So I was part of that team that worked with Ruth from the university and Sensory Trust, and we actually produced a qualitative evidence synthesis on older people's sensory experiences of the natural environment. And you can see that that was published, as you would hope and expect, in an academic journal. But we just, of course, didn't want to leave that there. It worked very well for the Sensory Trust because it expanded its knowledge base, and it gave them sort of a more explicit evidence base that they could use to present to funders and clients when they were seeking funding or other projects. And I guess it also empowered them to advocate for change in practice among care professionals, practitioners, and carers. So we continued to work together, and we looked for funding for dissemination of our findings, particularly for the residential care sector. And we secured funding from the ESRC Impact Awards, and that enabled us to hold a workshop as a way of really exchanging ideas on how people that worked in the care sector, what they were could use, what they would be interested in terms of training for enabling older people that are in care homes to actually enjoy and experience a natural environment. And based on that, then we were able to go for further funding, which enabled us then to produce My Nature, a training toolkit. And we collaborated with Sensory Trust, and we collaborated together. Part of this toolkit had 2 evidence booklets, and that was where we worked, the Sensory Trust, we worked together to distill the evidence to make it as useful and attractive as possible. So we kind of geared one for managers who might want to use the evidence to make a case, perhaps with commissioners. And similarly, then we produced something that we thought would be more accessible, that perhaps care workers could dip into and lift up out key facts. So then thinking on My Nature, it kind of like comes round full circle, because we did then present that and shared it more widely. We went to the UK Dementia Congress. We also published a short article in the Journal of Dementia Care. And that was with the aim of reaching more widely, but with a very sort of practice-oriented, it's kind of emphasizing sort of that this was geared for practitioners and care workers. So I think that's probably, we can come back, discuss any of this, but it's just to sort of give you a flavor. And you can see that that was very much about a collaborative relationship that developed over time and involved sort of co-production and working closely together. So if that's okay, Harry, I'll come to the third example. And this third example is about being part of a team that produced 2 mixed methods reviews on how animals and robotic pets, or robo-pets for short, impacted the care and well-being of care home residents. And these reviews, in fact, originated from a care home forum that had been part of the Penn Clark. So that's Penn Clark was before Penn Arc. So it was part of a kind of a research prioritization discussion, and the idea for the research questions emerged from a research prioritization process. And so we produced two reviews over a period of time. These again were published in academic journals, BMC Geriatrics, the International Journal of Older People Nursing. But again, it was, well, how can we communicate this best to those people, care home managers and staff who are looking after older people. And existing research does show that although care home staff may have a positive attitude to their research, there's probably an actual sort of a low use of research. It's probably to do with the kind of task-oriented environment they work in, access to information and sources. You know, they're not likely to have time to go onto the computer and go onto the internet. So we produced two newspaper-style briefings with the idea that they'd be short, they were easy to read, they could be visually appealing. But we thought we wanted to do something a little bit more. So here we, you can see that we decided that we would produce a board game. And this idea, I guess, stemmed from going along to a seminar, and we were introduced to the idea of board games as a kind of a fun, novel way to engage people with different subjects. And we could see that there could be a way of sort of breaking down complex information that's probably a bit dense and making it a bit more accessible, and also hopefully making it fun. So we applied for funding again from the ESRC Impact Awards, and that from securing that funding, that enabled us then to work with a Devon-based artist, and as you can see, what created Pet Pursuit. So that is sort of, I feel I've probably swizzed through that, but hopefully it gives you a little bit of a glimpse into some of the things that can do and what I've been involved in. And obviously across these examples, a lot of this, what we produced, it was very easily shared on social media because we've got images, and we did share a lot of what we did in terms of communication on Twitter. So I think I'll leave that there, Harriet. I think that's enough for me at this point. Thank you.
Thank you, Noreen. That's fab. Yeah, and as Noreen says, that was a whistle-stop tour, but we will be going into some of those examples in a bit more detail in further slides or sections of this workshop. So we've got our first exercise now, and this is really just to reflect on the examples that you've heard from Noreen there, examples that you've got from your own work. And if you can access the Padlet, either using the link here or the QR code, could you write what you think are the 3 key ingredients for successful creative communication of research findings? Now, I will put in the chat that link as well. Bear with me. We're going to take 5 minutes for this. Again, if you want to take that time just to go and have a little stretch, go and make your cup of tea, that's fine too. But we'll come back and have a very quick gallop through that. Let me just pop this in the chat. Multitasking. I think I can do it. Right, everyone. Da, da, da. Here we go. That's the Padlet link. Yeah, so we'll come back in 5 minutes and just talk about examples that we've come up with. And then we'll move on to some more examples of the range of activities that we've been involved with in terms of communicating research in more creative ways. Okay. Hopefully you can all see the Padlet. If you can't, if you have any challenges, let me know in the chat and we will troubleshoot. Otherwise, I shall mute. This is great. Thank you so much for adding in here. There's really super comments, and you can tell that this is an engaged audience of people with quite a lot of experience in this area as well. So that approachability, if face to face, but also actually it can be in a remote sense if you're doing sort of online workshops, or if you're talking to people on a one-to-one basis. That's really important. Having a relevance to the audience. Visual appeal, having something that's beautiful, recognizing the expertise that's out there. So using a graphic designer, making sure it's inventive, making sure it's clear, concise, having really targeted messages, making sure that you're targeting the people that you really need to talk to. clarity of message, beautiful, absolutely key. Simple, visually engaging. These are really, really lovely examples. And thank you very much for your contributions. Please keep adding them in, because this is open throughout this workshop, and I think it's a really useful way for us to reflect on those really important factors. We will be coming back to this as well within some of our next slides to just crystallize some of those examples of, for example, simplicity, the visually engaging elements, which can really make a difference to how you are getting your research messages across to your target audience. So thank you so much. Clarity, so important, but really, really difficult to do in many situations. So all of these are really great examples. Please keep adding. You'll see there we've got exercise 2 lined up. So that's for later on, but there'll be more opportunities to contribute on this Padlet. So that's great. Thank you.
I think, Harriet, just would add in that, when we think about clarity, it can be really useful for us as academics when we're thinking about our research. It really, I guess, whether you want to use the word forces, but really to crystallize what is your research about, and how do you communicate this? Because quite often we're always caught up in sort of writing things in such an academic way, that then when you think about creative communication, you really have to distill down what your message is. So I think it's actually really useful for us as academics.
Completely agree. And I think a lot of the time, as you say, sort of in academic research, we are very much about the words. We take 3,000 words or 4,000 words to communicate things with nuance, with subtlety, making sure we incorporate all the caveats and all the subtleties of the research itself. But that exercise of really drilling into exactly precisely what it is you want to be communicating isn't necessarily such a rehearsed skill. So it is a great opportunity to do that. And actually, we will be coming back to that in workshop 2, and particularly in workshop 3, where we are hearing from Dan, who is one of the co-founders of Scriberia, which is a visual thinking agency. And they are absolute masters at this, and we'll see some examples of their work in a second. So we will move on, I think, to those diverse activities. We're going to give some examples of some more examples of work that we've been involved with, where innovative approaches, the board games that Noreen's already talked about. We're going to talk about some newspaper style briefings, handbooks that we've produced, drawing from real world experiences as well, drawing in terms of feeding from, but also literally having scribes and live illustration within different spaces. And while we're talking about these, you might want to reflect on your own research and maybe things that you've got coming up, or a notional sort of piece of work that you would like to do, and think about those audiences, who you are working with, who do you want to reach, how do you get there? So to begin with, I'm going to give an example from the Nature on Prescription handbook. So this is a piece of work that I was involved with a couple of years ago, 2021 now, 3 years ago. And it was a lovely piece of work funded from UKRI and NIHR. It was a piece of work with colleagues at the European Centre of Environment and Human Health, and particularly in terms of producing the report, the co-authors were James Fulham, Becca Lovell, Karen Husk, Richard Bing, Dave Richards, Dan Bloomfield, Sarah Warber, Mark Tarrant, Jenny Lloyd, Noreen, Lorna Burns, and Ruth Garside, who led the project. We also partnered with non-academic research partners at the Wildfowl and Wetlands Trust, and we had illustrations created by Scriberia. So this is a company that specializes in visual thinking, and the handbook itself that we produced was built on an awful lot of research from a systematic review, realist review, and various interviews that took place over the previous few years with a whole range of stakeholders. But all of the evidence that we'd pulled together from that, we distilled into this handbook. So the point of the handbook was to help inform how nature on prescription can be used to support people's mental health, and also to make really practical evidence-based suggestions for how to develop and implement that sort of high quality scheme in social prescribing contexts. The handbook itself was produced for nature-based providers of those group nature-based interventions, particularly targeting common mental health conditions, and also for practitioners like link workers, general practitioners, mental health practitioners, and also researchers with an interest in social prescribing. More broadly, we've found that actually there's a huge number of additional groups that are interested in this work. So it's been particularly taken up by policymakers, by people within, for example, health commissioning roles, and others sort of related to social prescribing, but also mental health interventions in general. So it's been an amazing piece of work. There on the slide, you can see on the left-hand side, that is the front cover of our handbook. And these are a couple of illustrations that were produced by our scribe, who was incredible in terms of understanding the brief and then translating our work into visual sort of form. Absolutely phenomenal. The next slide here is an example of the infographic that was developed as part of this project. So it wasn't a huge budget actually that we had. What Scriberia were able to do was to very, very efficiently use the time and the space we had, which again, it was not a long project, it was a 9-month project, but they produced this infographic which represented very, very clearly what our key messages were, what the main outcomes were that we wanted to communicate. In a very complex way, we'd produce this evidence, but actually they managed to distill down to these beautiful croppable images. So you can see here we identified mechanisms of outcome where nature on prescription activities can work particularly conducively. So we've got physical activity, we've got creativity making a difference, groups, personal growth, relationship with nature, having fun, being outside and caring. And again, you can see within these illustrations, there was a real diversity that we wanted to reflect. We wanted to reflect people's real life experiences. So that was amazing. And the illustrations produced enabled us to sort of spread the work in ways that we hadn't even anticipated. So it was really, really interesting project. We have had well over 4,000 downloads of the handbook. We've stopped monitoring that now. Over 72 countries across all continents, places like Andorra, UAE, Switzerland, plenty of countries sort of across South America and Africa. So we've had a lot of interest. I will move on to firstly thanking the people who contributed to that handbook. So this was a large group of stakeholders who helped us iterate various developments of that handbook. And we had that through online workshops because most of it was still pandemic situations. So it was a phenomenal piece of work. The next one is the parent project, which was a systematic review, a relatively straightforward systematic review that was working with a non-academic research partner who runs a charity in Exeter called SNUG, which is support for neonatal parents, so parents of babies who've spent time in neonatal units. And this piece of work was a systematic review to look at how parent-to-parent support or peer support could be a positive introduction for parents of babies in neonatal units. So this was NIHR funded. As I say, it was a straightforward systematic review, but because we had that involvement of a charity within the research team, we made it a far more creative process. We had a parent advisory group made up of parents with babies who'd been in neonatal units. And that was a phenomenal experience because we met them where they were. We went to parent and baby classes. We went along to chat to people within their soft play areas. And we had their advice throughout the program of work. So we constantly had that feedback about whether the messages we were putting out there were appropriate, they represented them, and we had an awful lot of insights, particularly on the research process from them as well. So people contributed to screening of papers, they contributed to sort of shaping key messages, and it was a really integrated process. As part of that, you can see here, I've put some examples up. We had our journal publications. We also produced a range of briefing documents. So They've Walked the Walk was a briefing paper for GPs and clinicians at primary care level. And then we produced an article in Nursing Magazine, which was one of the magazines that neonatal wards have free in their staff rooms. So we wanted to make sure that actual practitioners had easy access to this evidence. And that was particularly successful. And we found out about that by chatting to members of our research team who were neonatal nurses. So it was a very collaborative project, this one. We were shortlisted for a public engagement award at the NIHR CRN Southwest Research Awards in 2020 for this. So again, this is an infographic that was produced which gives the key findings of our systematic review. Quite often in a systematic review, you don't necessarily think of it as particularly creative in the way you might put across the evidence, but this was really eye-opening for me in terms of understanding how you could use different methods to give out those key findings. I'm now going to hand over to Noreen to talk a little bit about the Woofington Post and Daily Muse.
Thank you, Harriet. So this takes us back to the 2 reviews on the pets and robo-pets. And as I just very quickly said, that we wanted to communicate these findings to care home staff. And we know that from research, the care home staff may be positive about research, but actually their use in daily practice is quite low. And as I briefly alluded to, this is most likely to do with accessing information and their sort of the staff motivation to read lengthy kind of papers in their care home environment is really not going to happen. So we wanted to communicate the key messages from the research. We want it to be short, easy to read. So this is picking up on some of the points that you put in your sort of the initial ideas that you put in the chat. So we want it to be short, easy to read, and visually appealing. And I hope it does look visually appealing to you from what you can see on our slide. And we wanted it something that someone could perhaps just read as they were drinking their coffee or eating their lunch. And we had it available as paper copies and also electronically. We also had links for more information if someone was interested to read more, explore more about the topics. And I suppose when we think about what actually happened, we did distribute it, which on reflection did tend to be more electronic. And I suppose it was quite challenging to think about distributing these in hard copy to care homes. But at opportunities, we were at events or whatever, we did take paper copies with us. I suppose to sort of reflect on that, we worked hard to make it visually appealing, and I guess you probably, some of you have already done some of this stuff, you really like what you've done, but you have to be aware that it's not going to suit everyone. And I guess the written format just doesn't suit some people. That's just not how they engage with information. And of course, newspapers like this, they can, whether they're electronic or hard copies, they can easily be lost within the whole mass of information that's received. And probably what will and one of the messages we are saying today is that, you know, it's not about one size fits all. It's about using a whole range of methods. So yes, we use these newspapers, but we also had other ways of communicating as well. So on the next slide, I'm going to say a little bit more about the board game. So again, we were still thinking about our care home staff as our audience. What we really wanted, our aim was that they would be, that they would really engage and think of some of the benefits, but also some of the challenges of having animals reside or visit care homes. And that sort of captured what was in our review. And so you can see that we devised our board game on the the classic snakes and ladders board with the numbered and graded squares. And that was also a decision, picking something like that most people are going to be aware of. And sort of the focus was also on the decision-making process. So for the staff that could consider this as a possibility, introducing animals into the care homes, we devised treat cards that gave the player a turn. We also devised pause cards, which meant that the player had to miss a turn. And with the treats card, each of those cards would highlight a particular benefit of animal therapy for care home residents. And we also used particularly qualitative evidence, so perhaps a really nice quotation. In effect, a little story that illustrated a particular benefit of having a pet or a visiting animal in a care home. And then the pause card was that the player would actually consider some of the issues, some of the practicalities, some of the challenges of having animals in care homes. And this happened just before the pandemic, and we had, as part of our funding, we were able to go and visit a couple of care homes here in Devon, and we presented Pet Pursuit to them, and we weren't able to sort of follow that through because we were basically overtaken by the pandemic. But some of the observations we had, some of the staff, they did play the game, and the conversation, that was what I think was the key thing that came through, is the conversation that they actually had, because they had to read out the cards, and that just had people chatting through and thinking through some of the issues. And I suppose the other side to that is that we had to think about, well, would staff again have time? We had hoped that it'd be one of those games that you could perhaps just pause. You could have it open, you could play, and then if you had to leave it, that would be fine. But the care home environment, when you're actually there, you realize as buzzers go on, people are in constant demand. So it is a challenging, just a challenging environment for people to engage, have the time to engage with research. Just want to add in so that when Harriet mentioned about the prize, the board game actually won the Social Research Association's annual conference Research Gallery Prize in 2019. So as I say, just before COVID. And I guess the whole sort of pandemic did limit us somewhat in testing it out, but perhaps that's something for another time. But again, it's there's the pros and the cons of what works for some people, and perhaps that's what you have to do. You have to think of different things. The newspaper, the board game, and you can see that in Harriet's examples as well with the parent. There was a number of things coming together, and I think that's all I want to say on that. Harriet, thank you.
That's fantastic. Thank you so much, Noreen. I love that board game. It's such a neat example. So now we are going to go into our second exercise. So part of this idea is around these examples from real life. So we've talked through a few things here from the parent project, nature on prescription work, the pet pursuits, and the care home examples. From your own work and from things that you might like to do, we'd like to put you into small groups now and just have a quick chat about different approaches you've seen, different things that you might like to use. And don't hold back if there's other things you want to chat about in terms of, some of the challenges you might see, some of the questions you've got about the practicalities. That would be really good to hear about. And then we'll come back after a few minutes and just have a quick discussion about that. We'll then go into our 10-minute break to have a bit of fresh air and an escape from screen time. So if you bear with me, I'm going to create breakout rooms and you'll get a message popping up in a second that will allocate you, and you can join or you can wait to be popped in. Okay. I'll send you a message when it's time to come back, but we've got about 8 minutes or so.
Time flies, Harriet, doesn't it?
Time really flies. Is it just us in the room now? Yeah, looks like everyone's been allocated. Is that right? Anyone else here? No? Good. Lovely.
The only two that I can see on my screen is Katie and Anwar.
So
are they allocated?
Anwar? Oh, Azari maybe? And Katie.
Yeah, oh, Aslari. Alasari, yeah.
Sorry,
much
Alasari.
better.
We are mashing your name. Let's just check where we are. Not joined. That's fine. They haven't joined.
Okay.
So we've got one room with 2 people there, but that's okay. That's fine. Good. Did you just see the
I'm just about to just see that now, Harriet. I'm going to reply.
The allocations popped up on the screen there.
Sorry, what did you say there, Harriet?
Did you see the allocations pop up on the screen there?
No.
No, good. That's good. I'm not entirely sure when you screen share if some of the administrational bits pop up on the screen that you're sharing, whether you can actually see everything. Anyway, we're all good. We'll give it 5 minutes or so, and then we'll bring people back. Right, I think we will start bringing people back in. Going to give them a minute. People are just starting to rejoin us. Thank you. It always fascinates me how varied the timings are for people rejoining.
Yeah.
Yeah. I hope that was an interesting discussion. Thanks, Georgie. It's nice to see you. Hi, Stella. Thanks, everyone. So it would be really interesting. Again, if you want to put anything on the Padlet under exercise 2 for these discussions over the next few minutes or for the rest of the workshop, please add into that. But for now, it would just be really interesting to hear in the chat what sort of things you may have come up with, whether you've seen some really good examples, whether there are things, maybe even some really, really imaginative things or things you'd never seen done by anyone else that you might be interested in. Or feel free to put up your hand or just unmute yourself and chat. That's fine too. It would be great to hear from you. We'll just take a couple of minutes to chat through this. Alternatively, if you have any questions for us, so for example, there's been a little bit of chat around the costs of these things, how much you actually budget for and how you get these agreed, that sort of thing. Or if you've got any questions about what we've presented so far, then please do let us know. Brilliant.
Can I come in on audio
Please.
rather than typing?
Yeah, absolutely.
Not a speedy typer. We talked a lot in our small group about infographics and posters, perhaps the difference between the two and the skill needed, and that shift towards more use of those visual mediums, which perhaps is about that increasingly wanting to disseminate to a much wider audience. So that was the main thing we talked about, sort of those two particular mediums, that how useful they were, but also sometimes perhaps the technical skill and the creative thinking that might be needed to produce something that really looked good and wasn't just still words, but happened to be on a poster.
Absolutely. That's really good to hear about. Thank you, Georgie. And I, yes, completely agree. I think I'm seeing so many more graphic posters and visualizations in maybe using the sort of more standard academic outputs in terms of conference posters, that type of thing, but using far more creative means to convey that information than just text. Stella, thank you. You've got your hand up.
One of the barriers that we've also identified was the, first of all, lack of awareness around different tools or how to do these things, which kind of lies within education, but also the lack of access to some of the tools, such as Canva. So the university is not subscribing to it. You have to pay your own subscription, even though I see so many peers using it, and it's the single easiest tool available to make anything that you do more accessible. Yet we don't have an access to it unless you pay. And even though it's a small fee per month, it's still a fee that comes out from your pocket, essentially, at the end of the day. So
Yeah.
the access to those tools to make it easier if you don't have a team who does infographics for you.
Yeah, that's a really good point. The access is, and the gatekeeping, I guess, is another thing. So like you say, sort of knowing where things are, knowing how to get to them, but also, like you say, so many things are behind paywalls or have a small, reasonable subscription that actually we don't have access to, particularly if one is an earlier career researcher or, you know, PhD or master's researcher. It's not easy to make those budgets flexible.
Actually, it's something that the whole university uses, and in all modules, even with undergrad students who are doing.
Yeah. We just lost you for the last second there, Stella. But Canva is an interesting one because I've used it for a couple of projects over probably 6 months ago, but not that long ago. And I used a free version. So maybe it's changed, or maybe there's a way to get around it. But I'll have a double check about that and see if Canva is particularly behind a paywall for us at the University of Exeter. Did anyone else have any thoughts or reflections on maybe some of those challenges, some of the barriers to getting, you know, illustration or visualization or graphic skills into their work? Might be practical barriers, perhaps. Hi, Pia.
Sorry, were you talking about a software pack? Canva?
Canva, C-A-N-V-A, yeah.
Canva.
It's worth having a play around. If we can find free access, it's worth having a look. Hi there, Loretto.
Yeah, I just dropped into the chat. There's some impact funding that's available in the university, and I'm using it at the moment to get some graphic designing done around my project, because we're going out to practitioners and to do a consultation later on in the year. So if I definitely have tried to use Canva, I actually have 3 separate accounts because I share my projects between the accounts, and then I can dodge the license. But it would be better to have a university license. If you can somehow get it for us, that would be amazing. I've dropped the link into the chat. Some of the impact funding is really helpful in terms of getting your design help, because professionals are much better. And I think the key for us, and what we talked about in our group, was actually making sure you have a really clear message of what you're trying to do.
Absolutely. And like you say, I think that's what you were sort of indicating. Actually having the professionals to facilitate that is a really, really key first step. And that's what I've found with all my work. It's been so valuable and worth 10 times any money that it cost.
Yeah.
But
it's quite
it is
useful to bring them
also
towards the end of the. I mean, you do have to do quite a bit of the thinking before you engage them, because otherwise you're not making the most out of their professionalism.
Well, it's an interesting point, actually. That's a really interesting point, because you're right. Some people are creatives that you would bring in to, you know, create a ready briefed product that you have a really strong idea already, what it is you want to create. Some actually help you through that thinking in the first place. So we've worked with a few, and actually the examples I've given, the Parent Project and Nature on Prescription, we worked with those creatives right at the beginning of the project to help scope out those key messages, look at sort of examples of things that we'd seen that we'd like it to look like. And actually so much of our thinking became much, much clearer through that process. So there's a range of different approaches depending on what it is you're looking to create and what time and budget you have. So we will, just letting Stella back in there. I think we'll have our break now. We're a couple of minutes over, so we will come back at 11:47. So we're going to take 10 minutes. If you're a couple of minutes late, that's fine, but just go and have a little stretch, breath of fresh air, cup of tea, whatever you need, and we'll see you in 10 minutes.